The pandemic really affected us in many ways, and taking care of patients, wearing the PPE and dealing with a patient that was actually very with anxiety and stressful because not knowing what was going to be the outcome coming out of COVID, or the family on the phone not being able to actually talk to being close to the family member. I believe this was one of the hardest moments, trying to compensate for the need of the family at the bedside, and it was very difficult.
All the testing, all the faxes we needed to send to the Department of Health, just keeping track of the days, new positives, false positive. It was just so much tracking. I have so many binders. The training, return demonstration, competencies, keeping track of all that was a lot of time consuming with the paperwork.
Challenge dealing with new nurses, because usually when we have new nurses we go through a process of training, and we don't actually send them to the floor unless we feel comfortable with their skills and their competence. However, like I said, being short of staff and having so many also nurses going into the field for vaccination or whatever the case was. I mean, a lot of nurses, they actually quit because they were afraid of the virus. Some other nurses, they actually needed to go home because they didn't have anyone to take care of their kids at home. Then it was very, very difficult because, especially me as a director of nursing, knowing that I have a nurse on the floor that is unexperienced, it's kind of like it scared me a little bit, but we needed to deal with that. We needed to actually do our best, and what I did was constant supervision and constant education, so we could really cope with the pandemic.
Well, because there's people that are scared, there's people that want to be home with their family, there's people that just decide that, they want to go into another field because this is too crazy for them. Mm-hmm. Even if they've been working in healthcare for 20 years.
It's the breaking point.
Yeah.
Well, when we were short staffed because of people positive being quarantined, it was all hands on deck. Mm-hmm. And so when I could have been helping out in the trade line, or the DON could have been helping with, some things in the floor, we had to be doing this type of documentation. And if we didn't, keep it up, it will back up too much.
The 3 transport came at the same time. For the one for the Vitas, the one for the other 2. And when I saw that, I remember I was in the middle of the highway. And when they took the 3, all the people wearing a white suit with all the protective equipment, the N95s. When I saw my patients leaving the facility, struggling with respiration, I was feeling so overwhelmed, so frustrated, so like unable to do nothing for them, that I was crying. I was like feeling like Jesus Christ, until what this,
So I had COVID, and I know how difficult, how you feel when you're short of breath, and being isolated also is a major problem. Isolation lead to depression, not being able to have the family there. I think the uncertainty of not knowing what's going to happen to me, and listen to all the media and all the news, patients getting intubated, I'm going to die. You don't know. Some patients, they had a mild disease, but some patients, they really were severe. Like I said, I had it, and it was a very difficult situation for me. Even that I'm a nurse and I know what my patients were going through before. When I got the virus, I was like, oh my God, I'm going to die. I went through anxiety. Being able to see my family, my kids. Then it was difficult. But I think we're done good, and we actually, I think nurses have done, we are done a great job. I mean, I know doctors are there and they have the knowledge, the power to prescribe, but the nurses were really being like the hero, the true heroes during this whole pandemic.